You're welcome to my channel. Thanks for visiting. Today is going to be about triptans, but I'll be limiting myself to Sumatriptan. The pieces of information here will be similar to what you can obtain when it comes to any of the member of this family. And I'll be dwelling more on the brand Imitrex. Without further ado, let's go. Triptan will come under different brand names. Sumatriptan could be Imitrex, Imigram, and the list goes on. Let's examine the other triptans before focusing fully on Sumatriptan. There is Rizatriptan under the brand name Maxalt. This is meant for per oral use or orally disintegrating tablet. And let's pay attention to this. We cannot use this in anyone less than 6 years, so it's meant for age 6 years and older. Almotriptan, under this brand name, is meant for age 12 years and older. Zolmitriptan, the brand name, is not even meant for any child at all, not 6, not 12, and not younger. It is meant for anyone 18 and older. Still on other triptans, Eletriptan under this brand name, it is better not to use this at all in any child. Why that? The safety and efficacy in children is not yet established. Frovatriptan is similar under this brand name as per its use in children cannot be guaranteed because safety and efficacy have not been determined. But we can have some other facts about Frovatriptan here, that it is slow acting and has very long duration of action. So pretty useful when we are dealing with long-standing migraine. Naratriptan under this brand name is also available. It's slow acting and will have long duration of action. Therefore, pretty helpful for long-standing migraine. But we cannot use Naratriptan for anyone less than 18 or greater than 65. In other words, it is helpful only for anyone within 18 and 65. Now, Sumatriptan, that is the one we're going to study the most today. Can be in form of tablet for per oral use, powder for intranasal or spray, and injectable form for SubQ administration. Imitrex is a good brand for study here. Imitrex injectable is ultra fast, and more pieces of information about Sumatriptan and triptans generally now. By way of classification, all triptans, we can say that Sumatriptan and the rest will be anti-migraine agent. And specifically, serotonin 5-hydroxytryptamine 1B and serotonin 5-hydroxytryptamine 1D receptor agonist. Uses is well defined. Migraine headache, but also helpful in cluster headache and cyclic vomiting syndrome. We can find triptans and Sumatriptan in form of Axert powder per nasal route. We can get this brand and this strength. Also in form of solution for nasal spray. Can find generic and Imitrex or similar. Also in form of solution for SubQ as succinate. Remember I've said it is ultra fast as SubQ Imitrex. So you can find this strength or generic. Also as solution in auto-injector for SubQ as succinate. You can find this brand and this strength, including Imitrex or generic. Can be in form of solution cartridge for SubQ as succinate. Imitrex is also available, at this strength or generic. Solution jet injector for subcutaneous administration. You can find this brand and this strength. Can be solution preview syringe for SubQ administration in form of generic at this strength. Can be in form of tablet for per oral as succinate. Could be generic 25 up to 100 mg per tablet, or Imitrex 25 up to 100 mg per tablet. Administration. Can give it through this route, intranasal, SubQ, or tablet for per oral, and must be taken whole. No disintegration to take with water. In the face of migraine, it is better to go for SubQ route first. You might use nasal or per oral. I will explain when and when you cannot use any of these. Cluster headache. Yes, because triptans are not for migraine headache alone. If it is cluster headache, yes, you can use it. But remember your oxygen, please, 100%. Then you can grab the SubQ formulation, with or without oxygen. In this case, for cluster headache, don't use this brand, please. Correct timing, meaning you can't just use triptans anyhow. It must be only when the individual is having acute phase. So only for acute phase of migraine or cluster headache. Never for prophylaxis. Now, note this. If you are using it for too long, like more than 10 days, then you are causing harm because you are likely going to trigger medication overuse headache. So you think you are treating headache, but you are actually causing more headache. Then you must withdraw, please. If you start triptans and there's no response to the first dose, pause a bit, review again, consider another diagnosis, because it might be headache due to something else known as secondary headache. Might be systemic infection somewhere, or another problem, or even brain tumor, or just lesion or mass within the brain. Could be abscess, could be bleeding, or anything else. Now, mechanism of action. This is a selective serotonin agonist of 5-hydroxytryptamine 1B and 1D receptors. It has profound effects on intracranial blood vessels and sensory nerves of cranial nerve 5, that is trigeminal nerve. It is a vasoconstrictor and it reduces neurogenic inflammation. Contraindications, meaning when you cannot use triptans. In hypersensitivity reactions to triptans or any components of its formulation, no triptans today. in ophthalmoplegic migraine. That is the old name. The new name is recurrent painful ophthalmoplegic neuropathy. If that had been diagnosed in this patient, then no treatment today. Still on contraindications. In cardiovascular system, you will not admit treatments in the face of congenital heart disease, just as you will not do with valvular heart disease, or you will not give in anyone with ischemic heart disease, meaning an individual with angina pectoris or myocardial infarction, including myocardial ischemia. In peripheral vascular disease, no. In stroke, you will not give. In subarachnoid hemorrhage, no. In hypertension that is pretty high and not being controlled, no triptans today. In Wolff-Parkinson-White syndrome, you keep triptans off the table. Still on contraindications, in anyone taking monoamine oxidase inhibitors, please don't give triptans for at least 2 weeks apart. Okay, there must be 2 weeks apart. I mean, from the time you are taking triptans until you can take monoamine oxidase inhibitors, or from the time you stop taking monoamine oxidase inhibitors and you can take triptans. 2 weeks break, please. Why that? Triptans will be metabolized by monoamine oxidase. Now you are taking the medication that will inhibit that enzyme. You know what that means to the system. The examples will be Nadil or Emsan. That will be Venezine or Selegiline. Once anyone is on this, stop monoamine oxidase inhibitor. Allow 2 weeks before you give your treatment. So don't take monoamine oxidase inhibitors within 2 weeks before or after taking Sumatriptan. Still on contraindications. In severe hepatic impairment, you take all formulations off the table. But in mild hepatic impairment, you may use SubQ formulation or intranasal formulation. Why that? You are avoiding the per-oral route completely. But discuss with your pharmacist. Warnings. I've said earlier that in severe hepatic impairment, no formulation is acceptable. But in mild hepatic conditions, hepatic disease, you might use non-per-oral formulations. But if you don't have alternative to per-oral formulations where you are working, then discuss with the pharmacist or clinical pharmacologist in your jurisdiction, and you may take the risk to use the per-oral formulation. But I would rather go for the lowest dose under this situation and for the shortest period of time. Still under warnings, we must exercise caution in the face of positive history of seizure disorder. And we have to rule out cardiovascular disease in elderly patients if we are faced with associated risk factors in such men or women. Remember the correct timing of use also. Only for acute phase, not for prophylaxis. Don't use for too many days because it can trigger medication overuse headache. Drug-drug interaction. Remember, monoamine oxidase inhibitors, not acceptable. 2 weeks gap, please. But for all other medications that could interact with triptans, kindly contact your pharmacist or your clinical pharmacologist. In pregnancy or breastfeeding, it will be advisable that we go for other agents that will not give us any reason to worry. But if we don't have alternatives, we can carefully choose triptans, but have contact with the OBGYN specialist or pharmacist in your jurisdiction. A woman that is breastfeeding can do one thing and take triptans easily. Just express breast milk before the use of this medication and make sure that 12 hours will exist between the onset of triptans and the next breastfeeding. So no breastfeeding for 12 hours at least. I'll suggest the whole day. You can express breast milk that will last the whole day for your child. Monitoring. We have to check for the side effects, and I'll go into the side effects in a bit. We check for patient's response. Is this patient getting better? Of course, it's a matter of hours, right? We check for vital signs, blood pressure, heart rate, respiratory rate, temperature, what's going on. EKG, liver function test, renal function test. In people taking it for an appreciable number of days. The side effects here when it comes to cardiovascular system will include prolonged QT. With prolonged QT that is not corrected, it will lead to torsade de pointes. Torsade de pointes that is not abated will lead to ventricular tachycardia. You might start with monomorphic and becoming polymorphic. Polymorphic can degenerate to ventricular fibrillation. If no defibrillation occurs, then it can lead to asystole and the patient is in the morgue, is dead, only from triptans. Just like I've explained, arrhythmias can occur, can lead to myocardial ischemia and infarction. The blood pressure could shoot up. Remember, it's a vasoconstrictor. And coronary artery spasm, remember, it's a vasoconstrictor. In neuro, the side effects could include subarachnoid hemorrhage, hemorrhagic stroke, dizziness, tremor, vertigo, drowsiness, akathisia, and acute dystonia. In ophthalmic region, we can be faced with angle closure glaucoma, optic neuropathy, and visual loss or blindness. Abdominal region can present with nausea, vomiting, that is change in taste, ischemic colitis, and splenic infarction. Other side effects will affect respiratory system. Bronchospasm is possible with chest tightness and nasal discomfort. There may be pain, sore throat, jaw pain, chest pain, and headache from overuse. Some will come down with anaphylaxis, and any history of anaphylaxis should be reported promptly for appropriate intervention. Raynaud's disease and serotonin syndrome. Now, examples of the use of this medication in selected age groups. Intranasal is not used in anyone less than 5 years old. We will not. So, less than 5 years, intranasal route, no. But 5 to 18 years, correct, at this dose, okay? Greater than 18 years, yes. And you check this dose, right? After 2 hours, you can repeat the same dose, per the other nursery. You give the first dose to one nostril, wait for 2 hours. If there is need to give the second dose, use the other nostril. But in individuals within 5 to 18 years, you only use one nostril and a particular the other 5 milligram, 10 milligram, 20 milligram once. SubQ formulation. We cannot use it in anyone less than 6 years. So the child is less than 6 years, SubQ formulation, no. But greater than 6 years and about 18, yes, you can use Imitrex. Then check the dose again. Greater than 18 years, yes, you can have Imitrex. Now check the dose and Sumatriptan, okay? The maximum dose you can give in 24 hours is 12 milligram. You can repeat SubQ after 1 hour if the affected individual is not getting out of it. So it's acute phase, right, to abort the pain. But Zembrace dose is different in the sense that if you want to give Zembrace SubQ, then you give 3 milligram every 1 hour for 4 hours. So 3 milligram every 1 hour times 4, making a total of 12 milligram Zembrace in 24 hours. In case of the oral formulation, if the child is less than 18 years, we will not give. But greater than 18 years, you can use 25 milligram, 50 or 100 once. You might consider the second dose after 2 hours. Most people will just give 50 milligram once. The maximum daily dose you can give for per oral formulation is 200 milligram in 24 hours. In case of cyclic vomiting syndrome, you go for intranasal route, of course. Do you want to give per oral when someone is vomiting? No. Intranasal or SubQ and check the strength. Now start just once, please. In conclusion, this is a good medication if it is used appropriately. Always review and be sure of the diagnosis. And if you are confused, please contact your pharmacist and your clinical pharmacologist. With that, I come to the end of this short presentation on Triptans, making Sumatriptan as our main example. Thanks for listening. Share this with everyone having migraine or cluster headache. Please, if you have given the first dose and you are thinking of the second dose and there is no relief at all, please review your diagnosis again. You might be dealing with secondary headache. Is there bleeding anywhere? Could it be brain tumor? Could it be infection in the system? Is it another drug that is causing it? Or anything else? Find out, please. I appreciate share with everyone on your platform. Thank you.